Well, yesterday marked World Polio Day, a global reminder of how far we've come in the fight against one of the world's most devastating diseases, and how much work still lies ahead. For decades, vaccination has saved millions of children from paralysis and death. And Nigeria, once one of the last countries battling the wild polio virus, was declared polio-free in 2020, a milestone made possible through years of hard work by health workers, community volunteers, and global partners. But sustaining that success means ensuring that no child is left unvaccinated.
Now, this year's theme focuses on protecting every child, strengthening routine immunization, and building trust in vaccines. As misinformation and insecurity threaten access in some communities, experts warn that complacency is not an option. So today, we're asking, how far has Nigeria really come in maintaining its polio-free status? What more needs to be done to protect our children and communities? Join us here in the studio to discuss this is Dr. Yusuf Ademola Harini, the founder of Love for Health organization. He says he's probably known as Dr. Love. Thanks for joining us.
Thank you very much.
So, of course, we celebrated World Polio Day yesterday. What is the central message for this year's celebration?
Thank you very much for this important information and this question. The aim of this year's information is to prevent polio and eradicate polio completely from the surface of the earth. As we are talking now, there are 2 countries that still have the wild polio virus, one. And these countries are Afghanistan and Pakistan. The reason why these countries have it is because they don't allow their people, especially the newborns, to be vaccinated with polio. Because of religious reasons, illiteracy, ignorance, and also their terrain is very, very tough. Because in Afghanistan, even that's why when the US wanted to invade there, they found it difficult. The place is very, very difficult. We are lucky here in Africa, there is no wild polio vaccine, virus, because of the vaccination. Although there is another type which is evolving even in Nigeria, in Democratic Republic of Congo. So we have the circulating derived polio virus. And this is because some people are not still taking vaccination, especially in the northern part of Nigeria. And Maiduguri was the state where the last polio was found. So we need to encourage them. The government needs to do more. We encourage them. We appreciate that they have been able to provide polio vaccination free of charge to all children, especially the newborns. But we need to make sure that we maintain it, because if they stop it, there could be a mutation in the polio virus and some people might get infected.
Well, I remember just like it was yesterday, you know, when Nigeria was certified polio-free in 2020.
5 years.
Yeah, 4 or 5, okay, yeah, 5 years. Now, 5 years later, how well would you say has Nigeria maintained that status?
Currently, Nigeria is still recorded, according to World Health, as having 0 polio infection. But we still need to maintain it, because for you to certify that there is no polio, you have to look at decades, 10 years, 20 years, or even more. Like in Egypt and other African countries, they have not even had the polio virus for decades and more. So good thing that Nigeria has 5 years, but we have to still ensure that everybody is vaccinated, especially the newborns. They have to be given what we call OPV, oral polio vaccine. We have OPV1, OPV2, OPV3. So when we were a kid, when I was a kid, I'm talking of close to 4 decades ago, even women used to go to houses in the polio uniform and they give every child there, they knock the gate, they give them the vaccine and they take it. Even till date, some people are still going. Health, they call them community health workers, community health extension workers. They go to houses, they give every child their polio vaccine and they tick the gate or mark the gate or write something on the wall.
Well, speaking of, you know, these community health workers, are they doing enough to educate, you know, the people in the north, you know, about the importance of the polio vaccines? Because there's this belief in the north that it causes infertility.
Yes, what you said is very, very true. They are to do more than what they are doing. They are doing their best. But you also know, due to this banditry, insurgency, terrorism in the north, many of them are scared of their lives and they are afraid to go into these rural areas.
Yeah.
Absolutely, because it's something which has to be eradicated for decades, as I said. For decades, it shouldn't even come up, because if one single person has a polio, and it's very obvious to know when somebody has a polio, they have the paralysis of the lower limbs, they can't walk, and it's so sad. If one person has it, statistics have shown that many people in that society are carriers. It's just like if one person has a manifestation of an infection, there is a high tendency that a herd, that is a large number of people in that society, have the infection. I'll give a good example. It's like HIV virus now. They are all viral infection, or hepatitis. If one person is showing a manifestation of HIV or hepatitis, there's a high tendency that many people have been infected due to their intermingling and things like that. In polio, it is even worse. So that is why it has to be eradicated completely, even in the north. Because if one person is showing manifestation or is infected, there's a higher tendency that many people have contracted this disease or this infection, this viral infection. So it's something which has to be taken. I still believe that the government, especially the state government, the local government, and their emirs, their rulers, have a big role to play to educate them that they should all take this. And also, it's a misnomer thinking that, oh, the polio causes infertility. No, there's no research that has linked polio. Some of them also have this misconception that the West is trying to reduce our population, like Bill Gates, who has been funding polio and many things, many voluntary charity works in Africa. Bill and Melinda Gates Foundation. But many people think, oh, Bill Gates wants to eradicate, reduce the population, reduce our population. It's just like the COVID also. Many of them thought, oh, the COVID vaccine, don't take it. If you take it, it's going to reduce the population, it's going to cause infertility and things like this. I think these are just misnomers. They are not based. There's no basis for it, and it's not founded.
What do you think is responsible for all these beliefs? Do you think it's lack of education?
Absolutely. Lack of education is number one. Ignorance. And one of the things is, I read a book which says, don't take polio vaccine, if not you will develop the polio. And they started ruling out some people that had the symptoms or that had the polio. Many of them, they have had this polio before even taking the vaccine. Yes, because some of them have taken it late. It's advisable that at birth, you give, there are certain vaccines you give at birth. BCG, one of it is for tuberculosis, vaccine for tuberculosis. Another one is OPV, oral polio vaccine. So it is good that once a baby is born, you give the vaccine. Then also there are durations, also schedules of immunization where the baby keeps taking it for a period of time. So the person will develop full immunity. Now, this polio vaccine we are taking, we should know that you are still introducing the polio virus to the child, but at a low dose so that the child will develop immunity. So I'm hoping that one day we would have HIV vaccine, so that, but in that process, someone might introduce the HIV as a low dose to someone and the person develops immunity, but there has not been confirmed cases of HIV vaccine yet. There are also some vaccines which they are working on in Russia, vaccines against cancer. Cancer is another deadly disease that is killing people in the world. So we hope that we get to that stage in medicine and technology where we develop vaccines for some deadly diseases like HIV, cancer, and on a lighter note, maybe there will be even vaccines for politicians also to stop corruption.
Interesting.
Very funny.
That'll be one to look up forward to at the end of the day.
Right.
But besides awareness, what other challenges are we facing right now in terms of making sure that every child in Nigeria is vaccinated?
Funding. And that's why I said corruption in a rhetorical way. Because some of these vaccines also, which have been given free by the USAID, by WHO, UNICEF, Bill and Melinda Gates Foundation, some corrupt politicians are monetizing it, hoarding it, just as they hoarded the COVID palliatives and they hoarded even the COVID vaccines. So this is one of it. Ignorance and illiteracy is number one. Number two is corruption and lack of political will by the leaders. They are corrupt and they are not allowing the vaccines to spread. Some people, even in position of authority, like the emirs, the leaders, chairman of local governments, some governors, senators, they want a part or a region of Nigeria to still remain poor and to still remain ignorant. And because of this, there's association of diseases, widespread diseases in that area. Where there's ignorance, there is also a high level of poverty and disease, high burden of disease. Because they don't even have money to take care of themselves.
Absolutely. Beyond government's effort, what role does community, or what role do communities and parents have to play in ensuring a polio-free Nigeria?
Yes, what they can all do, and which I appeal to every mother in particular and every community, is to make sure that once you have a child, you take your child or your baby to the nearest health center, primary health center, to take this vaccine. It is free, completely free, at least in government hospitals. Maybe in some private hospitals, they pay for it. But in government hospitals, the government has tried to make sure that everybody gets it free of charge. So this is the role the community can play. Is also health education and health advocacy, to make sure that they keep educating themselves, like what we are doing here, to educate people to ensure that they are polio-free and they take the vaccine. But on the long run, I score the government well in terms of polio vaccination, because as at now, Nigeria, and not only Nigeria, Africa has no record of the wild polio vaccine.
In how long?
Now in Nigeria is 5. Some countries, as I said, 10. Some other countries are more. I don't have the full records of all other African countries. But the surprising thing is that Nigeria is one of the last countries to achieve it.
Yeah.
And the reason is because of our population. So this is another challenge. But we can't always keep hiding behind population. China is far more populous than Nigeria, and China is a developed country. So I believe we can use our population as a human power to even make resources. Why can't we make our own vaccine?
Absolutely.
Why can't we even use the population to educate people more, to empower ourselves, and to provide better health care?
Talking about us creating our vaccine. I remember during COVID, there were talks about a particular
we actually developed
vaccine that we developed. At least there was something that was made in, I think it was in Mozambique, some African country. But somehow it wasn't taken seriously, because of course WHO has to.
And politics as well.
Yes, I was in USA during that time in COVID-19, 2019, 2020. And I remember then also, I know that some Africans, some professors, even in Nigeria, were making effort to develop vaccines. Some were going through like herbal routes and were confirming that it will prevent. But if it doesn't come from the Western world, we always believe that it is not standard.
That's the mentality that we have.
And it's mad with corruption, with lack of due process, and different things are holding us back. So I think we are the ones holding ourselves back. We shouldn't always fall behind the shadows that the West is trying to underdevelop us. We are the ones not developing ourselves. We got independence in 1960. Singapore got it after us, I believe, 1964 or 3. And they are more developed. They are even among the developed countries in the world now. Malaysia is another example. India has high population, and they are doing very well. They have people who are doing great jobs even in USA. The head of Google and people like that. So I feel that we need to do better in terms of eradicating corruption, more transparency, developing our health sector, and improving, investing in research. And that was why I said this publicly when I had a speech. I was advising the government, especially the presidency, that increase Nigeria's budget. According to the Abuja Declaration, in 1999, when Olusegun Obasanjo was the president, he was advised, and they had even in an African summit in Abuja, that the budget for health should be 15% and above of total budget. Nigeria is still having a budget of 5.2%. And it's far low, far less than the required standard, and that is why we are having problems. So I feel that the government should invest more in research. The Minister of Health, Professor Ali Pat, is a board-certified medical doctor, also from the US. So he knows the procedures of healthcare. The Commissioner of Health in Lagos State also is a professor, and he trained also he did residency in the United Kingdom. So these are people who have international experience, just as I've also had it. So, but I don't know why we come back to Nigeria and we just have the Nigerian mentality
it really,
again.
really baffles
We should
me.
imbibe these good qualities of not. I'm not saying we should take all Western. I'm not in support of some things they do in the West. I'm not in support of all these LGBT and things like that. But there are some quality things they are doing there. We should imbibe them and practice here. Health is one of it. I feel we should improve in our healthcare.
Well, it's a good thing because we've recently heard stories of some doctors who were trained or, serving abroad, coming back, opening, clinics, to help with some of these conditions that are lacking in Nigeria.
Absolutely.
Yeah, but sadly, this is where we wrap up today. Thank you so much, Dr. Harun, for your
Always
time
a pleasure.
and for speaking on this.
Thank you very much.